As the MLA of the area, I've always felt like it was one of the most important jobs that I was given when I was elected to ensure that this facility would come to be. We're well aware of the overcrowding that has been going on and the vital need to have more health services in the south end of the city. 4 years ago, we broke ground on a new hospital for the city of Calgary. Premier Ralph Klein helped assist me at that time to lobby to get the vision going on creating this new health campus. So basically, we've just come in the front door of the hospital. It's obviously still under construction, but what would you describe this space as?
This is what we are calling the public street, and it's quite a long corridor, but it opens up onto glass and to the outside environment to bring lots of light in here, make it a friendly space. When the public come in, they're obviously going to be stressed and anxious, and this environment is geared to bringing down their anxiety, making them feel welcome, making them feel comfortable.
The number one question that I get asked is, when will it open? It is slated to open in the spring of 2012. This hospital will have 298 beds for its first phase. It'll do some 2,500 day visits a day. It'll have a full ICU. And we hope when it opens that it'll actually have 2,500 births a year here.
A lot of people don't realize how much has been done on the inside already.
No. It's really come along.
So again, this is the tower you see here is the ambulatory wing.
Okay.
And we're going to walk over there, which is the inpatient
So that's
wing.
the inpatient wing.
Yeah.
Okay. The inpatient rooms, having been in other hospitals, my overall impression was cleaner, safer, and more patient family focused. Much larger. I like the idea of having every room be a private room.
This is an inpatient room. This is where they and their family would stay. You can see this is a large room, but it's meant to allow for rooming in for the family members.
So where does the family member stay?
This is a bed area for the family members, so if they want, and there's a curtain here, so if they want to have a little nap, they can be here and still be with their loved one. 95% of all the rooms here look exactly like this. We chose the private room for the ability for patients to rest and recover, which means they get out sooner. For preventing infection and making sure that we're not transmitting bugs.
Our biggest issue, and the number 2 question I always get asked, is will it have an emergency ward? And we were able to tour that today and to see that it's going to have a very high-functioning, state-of-the-art emergency ward for this end of the city. Basically, this is the emergency waiting room. And what kind of capacity will this unit have?
This emergency department is designed for 40,000 visits, so that's a large volume.
My constituents ask me nonstop, will there be doctors and nurses for this hospital, and where will you find them, and how will you staff this hospital?
Some staff have already been hired, and we've actually put them in satellite spaces in the other hospitals in Calgary. We're going to hire the entire women's health team in the next couple of months so that we can have them working as a team a year and a half in advance of them coming onto the site. We have a plan and we're rolling it out.
I was quite pleased to hear that they are already in the other hospitals building units that are in a sense shadow units, so they're not waiting for the day this hospital opens, they're actually hiring a full year in advance. Not only is it a beautiful building with all of the capacity and things that you built into it, but that it'll have that really important component, which will be doctors and nurses and the staff that we need in order to care for us. Thank you very much. I think my constituents are going to be very interested in what you've been up to here. It's really wonderful today to come in and see what you've been doing on the inside.
You're very welcome.
To have this new South Campus, which will grow and have additional phases as time goes on and the community grows, is a wonderful addition. It was the work of a lot of involved people, and it's always a thrill for me as MLA to be able to go and take that good work up to government and actually get it delivered. My name is Cindy Ady, and I'm the MLA for Calgary-Shaw and also the Minister of Tourism, Parks and Recreation for the province of Alberta.